Welcome to Frontline, my favorite part of the show. Now, some of the veterinary laboratories government said will be adopted to support aggressive testing for coronavirus have since come on stream and playing a significant role already. With a capacity to process 2,000 samples a day, the Veterinary Services Directorate in Ghana has on the quiet been conducting COVID-19 tests. In this report, Latif Idris was at the facility to speak with the technicians who say even though they are professionals, they get disappointed each time they record positive cases.
In the eye of a storm like COVID, scientific and public health tools are essential.
The World Health Organization has identified testing as critical if COVID-19 plagued countries are to get ahead of the pandemic. Ghana remains one of the leading countries conducting tests for the virus on the African continent, and this has largely been because it's been able to add on to the number of testing centers such as the Veterinary Service Directorate. It sits on a 2-kilometer square parcel of land straddling the ring road approaching Labadi here in Accra. It may not be a Noguchi, but it is also delivering, albeit quietly. We are good to go. In a highly secured environment, head of the Accra Veterinary Laboratory, Dr. Theophilus Odum, gave us exclusive access to the Level 3 testing facility with a world-class testing equipment.
The testing procedure involves a lot, right from the extraction procedure to master mix preparation, adding of template. In all these process or stages, one might make a mistake. That is why we could say that the sample could be positive or negative or something like that. But however, when you have well-trained staff and you are using machines which are highly recommended by WHO, and you have a laboratory with a standard that we have, I think it is devoid of all contaminations and the doubt that we have.
Leader of Ghana's COVID-19 test team, Dr. Samuel Kaba Akoria, says the coming on board of the Veterinary Service Laboratory does not only reduce pressure on other testing facilities, but also puts Ghana ahead of the pandemic.
The first thing is that it augments our testing capacity. So now this department can do as many as 2,000 plus in a day. So what it leads to the second thing is that now when people take samples, when people are tested, they wouldn't spend a lot of time waiting for results. The third thing is that it reduces the work pressure in other centers like Noguchi.
The technicians who spoke with JoyNews say they sometimes get broken when a sample turns out positive after a test.
Whenever I see a positive sample, it really hurts me, and the first thing that comes in mind is where is this individual? Where is this individual? Is the person with a family? Is the person with friends out there? What is the person actually doing? Is the person in the hospital? What is really going on?
Anytime we are done with a sample and there's positive inside, I really feel bad about it, because I mean, I don't know who the person is, where the person is, and I also got family at home. We are working on these samples, and when you go home, your kids, your wife, everybody coming around you, you want to hug you, and like, oh, today we got positive, oh, I'm going home, everybody is going to come around me again. It's kind of bad feelings.
The technicians are putting their lives on the line to get Ghana ahead of the pandemic. But sources at the facility tell JoyNews the absence of PPEs has potential of truncating their work, even as they continue to receive samples from Noguchi for testing.
And we continue to applaud all of them, everybody that's working on the front line in these times. We're grateful. Thank you.